We go ahead and get started, and then I'll admit people as they come.
Sure. Thank you, Victoria.
Yeah, absolutely.
All right, so I'll go ahead and introduce us, get us started. So today we'll be presenting to y'all about interventions to increase transgender and non-binary youth sexual health access. My name is Alexa Karczmar. My pronouns are she, her, hers, and I'm a research coordinator and sexual health educator at the Adolescent Medicine Division of Lurie Children's Hospital. And I don't know if my colleagues would like to introduce themselves.
Yeah, I can go next. I'm Adam. I use they, them pronouns. I'm currently a program assistant in the same division of adolescent medicine, and I teach sex education and specifically our trans sex education.
Hi all, I'm Afiya. I use they, them pronouns, and similar to Alexa, I'm a behavioral research coordinator in the division, and I'm also a part of the HIV/STI testing and sex education teams.
Hi everyone, my name is Saleha. I use she, her pronouns. I am the program coordinator for the HIV/STI testing program at Adolescent Medicine, and I also am a sex educator.
So that's our stellar team. Today, we're going to be helping y'all to understand the kinds of barriers that trans and non-binary youth experience when trying to access healthcare and comprehensive and appropriate healthcare. We're going to talk about ways to support trans and non-binary adolescents as they navigate sexual healthcare and that whole system. And then we're going to provide a multi-level intervention approach to targeting healthcare providers, community members, and trans and non-binary adolescents themselves to improve sexual health care for their community. And group guidelines, which I'm sure we as a group are going to do great at. So this is a one mic space, so please take your turn. We have someone monitoring the chat, which I'll mention in a moment. So, raise your hand or shoot out questions as you have them. Be curious. There are no questions off limits as long as they're asked respectfully. So we know this is a topic that can be new to some folks or confusing, but we encourage all questions that come from a place of respect in this space. Accept and expect lack of closure. You can't cover the breadth and depth of trans and non-binary adolescent healthcare in an hour and 15 minutes. It's just impossible. So we're going to do our best here, and we would love to answer your questions, but there may also be questions that you are left with at the end, and we provide our contact information and encourage you to reach out to us. And then please do use the chat feature if you have questions or want to share comments. Afiya will be monitoring the chat, and they're a fantastic conversator, so I encourage you to chat with them. And I think that they will actually be getting us started with barriers hindering trans and non-binary youth access to sexual health care.
Yeah, so the first thing that we'll talk about today is bias. I'm sure many people who are attending this or who will be watching the video later on have either attended a training on bias or do research on bias or studied bias. But here we will talk about how this comes up in the context of trans and non-binary youth's access to healthcare. The first one is explicit bias, which includes attitudes and beliefs that are consciously accessible and controlled. So for example, this could include a provider explicitly declining or refusing to see a trans or non-binary patient. The more insidious one is the implicit bias, which is something that we'll spend more time talking about today. Implicit bias includes attitudes, stereotypes, and beliefs that are unconscious and automatic that affect how we treat others. Especially in healthcare settings, providers have less time and limited information processing capacity. So many of the providers' decisions are governed by implicit bias. Because implicit biases, like I said earlier, operate on our unconscious level, they may result in trans or non-binary patients receiving lower standards of care without the provider even realizing it. So for example, a recent survey of first-year medical students found only 50% of the sample to be explicitly biased towards LGBTQ plus people. However, that 50% number jumped to 80% when implicit bias against LGBTQ people was being assessed. This shows how much more common implicit bias is. And there's actually a number of different ways that implicit bias can come up in the context of trans and non-binary youths' care or healthcare. And let's look at a few of those. So the first one is halo bias, which is the tendency for positive impressions of a person to reflect positively or influence judgments and opinions in other areas. So, for example, tall people are more likely to be offered, a higher salary or, positions in positions of power. For example, a provider might view a non-binary person's gender presentation in a judgmental way, and might, affect their care based, and that might influence the kind of care they provide to that young person. Another way this implicit bias might show up is the unconscious bias, which causes the perception of an individual to be unfairly influenced by a single negative trait. This could be as small as a septum piercing or a tattoo. In the context of trans and non-binary healthcare, an example could be, a young person who's on puberty blockers and therefore looks younger. Providers could implicitly treat them like they know less about their medical care. Another way this comes up is affinity bias, which is the tendency for people to connect with others who share similar backgrounds, experiences, or interests. Affinity bias can come up in the workplace, and it may not seem like an issue at a first glance, but at more toxic levels, this could have serious implications for, diversity in the workplace, mentorship, hiring bias, promotion bias, etc. The last one that I want to touch on is conformity bias, which is the tendency for humans to behave similarly to other members in their group. So in a group of providers and medical staff, even if one person is biased against trans and non-binary people, others who are working with them could easily pick up on those behaviors just by the virtue of proximity, the fact that they work together. They could easily pick up on some of those implicit biases as well. Implicit bias is something that can be worked on and challenged, but it does require active work. And training can help with reducing bias, but we will be talking about training in just a second. But I want to touch on the slide that Alexa has up right now. Explicit and implicit bias also is seen a lot in medical and public health literature in the context of risk factors. Whenever we've been having a lot of these conversations lately in the context of the COVID-19 pandemic and, population analysis and comparisons of which groups have contracted COVID-19 more than others. So we know, for example, that Black people and immigrants have contracted COVID more than other groups. And the underlying cause of that is racism, is xenophobia, is lack of healthcare access. However, we see the language of risk factors come up a lot in medical or public health literature in, sentences like we have up here. So for example, trans women are sexually deviant and contract higher rates of HIV, or having a trans feminine identity is a risk factor for HIV infection. These are rooted in explicit or implicit bias. A reframing of this idea could be trans women face numerous barriers to comprehensive sexual health care due to transphobia. Risk factors without recognizing societal factors is often going to be implicitly biased or even explicitly biased and needs to be challenged. I think Sal will take us into talking more about healthcare provider training.
Absolutely, yeah. Thank you, Afiya. So as we can see from this slide, the average physician receives only 3 to 10 hours of sex education as part of their training. This is a very, very small amount. A 2011 study found that the median time spent on LGBTQ health across US and Canadian medical schools was 5 hours. The median reported time devoted to classroom teaching of LGBT health topics for the entire BSN program was 2.12 hours. It's important to remember that training can help reduce bias against LGBTQ students, but most providers get very little LGBTQ training, which, as we just saw, and especially not anti-bias training. 2 to 5 hours is nowhere near enough time to learn how to provide LGBTQ competent care and help providers challenge their bias and arrive at a place of cultural sensitivity, cultural humility, and competency. Moving on to the next slide. So we're going to talk a little bit about transphobia and cissexism. These are things that queer and trans people face, both within institutions and in society, in interpersonal sort of encounters and relationships. Physical violence, 1 in 10 trans people reported being physically attacked within the past year due to being transgender. The number of trans women being murdered in the US goes up nearly every year. We've already hit a record this year. Microaggressions, everyday, subtle, sometimes unintentional interactions or behaviors that communicate some sort of bias towards marginalized groups. This could be a bunch of different things. This could be as small as the way we use language for someone unintentionally. Of course, when we intentionally misgender someone, misidentify someone, to me, that's more than a microaggression. That's a macroaggression, really. But, you know, other things like how, you know, how we allot space to people, our tone, body language, things like that. All of these things accrue and accumulate for the way trans and non-binary people navigate life. And this is labor that they have to do constantly, sort of confronting and working through microaggressions. Systemic discrimination. 33% of trans people who've seen a medical provider, for instance, have had at least one negative experience. The burden of educating their provider is on them. They are often asked invasive questions, such as things around their body or sex life that has nothing to do with the kind of care that they are seeking, or even being denied care, often under the seemingly benevolent pretext that the provider does not feel qualified. What that really is that the provider has not sought out the education that they ought to have, or has discomfort stemming from biases, prejudices, transphobia, cissexism, etc. We're going to talk a little bit about intersectionality when we're thinking about transphobia, cissexism, and systemic biases and prejudice. So risk factors are exacerbated when people carry multiple marginalized identities. Think about the fact that if you are a trans woman and you're Black, you're vulnerable in all of these ways that are exponentially increased, whether it's homelessness, whether it's bias when you're seeking out medical care, whether it's hostility from providers, whether it's employment discrimination. All of these things are exponentially increased for a person who's both trans and Black. So intersectionality, which it really refers to how people are treated or marginalized based on how they hold more than one marginalized identity, is something that we ought to remember when we're examining the biases that we hold, or that our organization or the system we work within sort of perpetuate against queer and trans people. Next slide. We're also, when we're thinking about biases and discrimination, we also need to think about things that are on a systemic level, that are baked into the system. There's so many legal and systemic barriers for queer and trans people. For trans people, getting their legal name changed, getting their gender marker changed, getting them changed, first of all, within the larger system, you know, on your state ID, driver's license, birth certificate, but also within the medical system, can be very, very challenging. It can be a lot of work and can often discourage trans people from seeking out care, from seeking out various resources that should be available to them, but they can't avail themselves of because the barriers to access are so high. Barriers to gender affirming hormones under the age of 18. We already know that young people arrive at an understanding of their gender identity fairly early in their psychosocial development. So there's no reason to be, for them to have barriers to accessing gender affirming hormones and making those informed decisions about their body, about their identity. And also birth control access, the barriers to that, legal discrimination in terms of what resources they can access, and also what recourse they have when they are discriminated against. We know that there's not a federal employment protection act in place, and these are things that trans people navigate every day, in addition to the sort of micro and macro aggressions and individual encounters that these systemic discrimination, the systemic policies that uphold discrimination foment and encourage. We can move on to the next slide. And I think that is Adam.
This one's me. Yeah, so I can talk a little bit about our approach. I can tell you from the get-go that this is not a program that's really been been happening for a very long time. I believe, like, for me, like, I'm kind of starting it in June of this year, actually. So it's something that we've just kind of started working on and thinking about. And it really came out of like a position of need. So like theoretically, like already we know some of those statistics. We saw the one about how 33% of trans people have to teach providers. Other surveys have shown that that's significantly higher. It's up in like the 60s and 70 percentages. And especially when we're thinking about, again, like trans people with multiple marginalized identities. So trans people of color, the numbers like shoot up for like Black trans people and Indigenous trans people especially. And so like knowing in the back of my mind that trans people are probably not going to be able to access this information when it comes to accessing healthcare. And then this for me really started with, I got pulled in last minute to do some sessions at Evanston Township High School out in Evanston. And one of them was a sex education fishbowl. And in that session, we got a few questions that kind of like started me thinking about like even the sexual health care education that we provided at Lurie Children's Hospital and how that really wasn't providing what trans youth specifically needed. And the question that just like sticks with me, and it's a question that I get almost every time I teach sex education to trans youth, which is, will I ever be able to like engage in sexual activity without experiencing dysphoria? And that to me is like, that's like a question where you need to stop and pause and think about what's happening. And so I think realizing that like, that there's such a lack of knowledge that we never talk about dysphoria in sex ed. Like even the sex education that we do at Lurie Children's Hospital, which is gender inclusive, is LGBTQ inclusive, does not go anywhere near covering the topics that trans people specifically need to know about when they're getting sex education. And so then if you filter that out, other nonprofits that don't have an LGBTQ hint, it's even less. And then if you're thinking about like schools where their goal is to just kind of like talk about abstinence and STIs and move people on their way, it means like trans youth are literally getting nothing, right? And so after that, I kind of had this opportunity to work with a huge trans organization, and I literally like threw together the curriculum that we needed to start trying to teach trans youth about how to access sex education that actually works for them. And then after that, kind of the educator and provider sessions followed. So you can go back to the last slide, actually. You flipped me too soon. So who runs it? It's me, which is kind of a joke because I'm only part-time and I make like nothing. Anyways, so it's literally like that to me is like such an issue too, right? Is that this issue is so like under cared about that our program at like a top hospital that works with trans youth is led by someone who's like an underpaid program assistant, right? Like that is how undervalued this work is, and yet it is still so important. And then it's supported by our sex education coordinator, But again, she's also only part-time, and she's also a cis-identified person. And this last point on this slide is really important. It's something that will continue to get me in hot water for the rest of my life, because I like to sit on panels across from people with PhDs and tell them that they probably shouldn't be doing this work if they're not trans-identified, or if they are, they at least need to put a lot of thought into what they're doing and why they're doing it. And that's because I wholeheartedly believe that this program, and especially like any of the youth-facing work that we're doing, needs to be run and staffed by trans people. And I think like I think of it in two ways, right? Which is that cis people are really important, and they fill a lot of really important roles, and they can teach this type of content. And it's incredibly important for trans youth to not only hear this content, but to hear it from trans adults. And Saleha and I are usually the ones that are leading these sessions. Now you can go to the next slide. Okay, so this is kind of like the approach that we take, right? And so thinking about this like systemically, if we just bring this information to youth, it's not going to be enough. We don't have the capacity to teach every trans youth in even the city of Chicago about trans sex education. And so that's why we're also working with other community organizations, kind of as a Band-Aid measure to try to train them to be more trans inclusive. And then even if we create all of these trans youth experts, if our medical providers don't have the skills to work with them, it's not going to be enough to guarantee that they have access to sexual health care. And so that's why we took this kind of three-pronged approach. Specifically with trans youth, that's the curriculum that I developed, and it's going to cover a lot of topics that honestly I think all youth should be getting, but they're not. So things like pleasure. More and more we're finding out that youth want to learn about sex education from a pleasure point of view. They don't want like abstinence only sex education or like scare tactic sex education. They want to know about pleasure, and they want to know about masturbation and how to have a good time with a partner and how to do that safely. And for trans people, it's figuring out how to experience pleasure when you're also navigating dysphoria and communicating about body parts that are and aren't comfortable for you. Talking about PrEP, and especially for trans and gender nonconforming youth, where the conversations about PrEP are still so like binary and labeled in a specific way. And a lot of times trans youth, and especially trans masculine youth, fall through the cracks to accessing that. And then birth control. And that's one where like thinking about having to teach a provider, birth control is the one where I see this come up the most, right? It's trans youth, and especially trans youth on testosterone, are having to teach providers which forms of birth control they can even go on with the given hormones that they're on. And that's not anything that anyone between the ages of like 14 and 22 should ever have to do, is to become a medical expert in order to like be able to access birth control. And then thinking about the trainings that we have for community organizations and nonprofits, again, that's like that Band-Aid measure, right? And so finding who are our community partners that are reaching Chicago schools that we might not be doing, and age brackets that we might not be able to reach, and working with them to talk through like, what does your curriculum look like right now? How can you start it from the get-go in a way that's at least a little bit more trans inclusive? And then on the back end, like, if you are seeing, as you are making your programming more trans inclusive, how do you have those really difficult conversations that we know are going to start coming up? So like, once you make yourself a resource for trans youth, like, how do you have those tail end conversations where youth come and talk to you about like accessing sexual health resources and you don't always know the answer, things like that. So it's like building that community capacity to be able to reach even more youth. And then the provider trainings, which honestly started the first for us, I think just because we're a hospital. And so working with medical providers is something that we do all the time. But it goes back to that fact that like the less barriers there are for trans youth talking to doctors, the more likely they're going to be able to actually openly and honestly talk to their doctors and medical providers about the care that they need. And so that's why like all of those slides that we talked about at the beginning about bias and discrimination, that goes to every healthcare provider. Because then it's like we are training you and we know that you are implicitly biased. And that's okay. So like, let's work on that implicit bias that you as a provider definitely have. Or like, I mean, 80%, you most definitely have this bias. Like, let's work on that and reduce that, because you are making yourself a barrier for trans youth to access healthcare and that discrimination. So thinking about those larger systems at healthcare places, And then thinking about sexual health intakes. And this is something that Alexa actually does really, really well. And a lot of what we do pulls off of what Alexa has done for this, which is thinking about like all of those topics that providers are really uncomfortable about talking about. Things that are past like oral, anal, and vaginal sex, which is all that we talk about in the sexual health sphere usually. But we know that queer youth are engaging in more forms of sex than that. And so thinking about like, how do you get a provider to the level that they're comfortable talking about poppers and how to do poppers safely? How do you get a provider to the level where they're comfortable talking about BDSM and kink and how to engage in that safely? Because if you're talking or poly relationships and things like that, because if a trans youth or any youth in general is talking to a provider about sexual activity that they're engaging in, and immediately get shut down past like those 3 types of sex that are like the most generic, or like you can visibly see that the provider is uncomfortable when they're talking about that topic, that youth is not going to bring it up with the provider again, and they're probably not going to bring it up again ever when it comes to a medical scenario. And that might be something that they need to have a conversation about, especially like poppers. Like youth like don't know how to do poppers safely, so like we need doctors who can talk about that, or like BDSM and kink and things like that. Next slide. So this is kind of what we've done so far. Again, this is since like June. And so you can see here, we've seen about 100 trans and non-binary students so far. We've seen a few more LGBTQ youth. I've built out the curriculum to be a little bit less tailored, to specifically talk about some of more topics that LGBTQ youth might want to talk about. You can see that we've trained 2 area community organizations. Both of those are organizations that teach sex education in Chicago public schools. One of them specifically focuses on schools mostly in the South and West Side. So thinking about like reach that we might not have as much. And then over 200 medical providers and trainees as well. Some of these are at Lurie Children's Hospital. Some of them are not. And we have more medical provider trainings and trans youth sessions coming up as well. And so looking at kind of like building out into Evanston as well. I know I'm doing a training for all of the pediatric providers at North Shore Hospital coming up. And then, oh, and the other thing too with those medical provider trainings is having those conversations around how do you talk about like unsupportive parents with youth and how do you navigate that? And I think we'll talk about it a little bit more later in this presentation as well. Next slide. So we did want to talk a little bit about some of the barriers to creating and expanding our program. I think a big one is funding. And I could spend 90 minutes talking about lack of funding specifically for trans and gender nonconforming folks, and I wouldn't be able to scrape the surface, right? Like we know that like systemically, we're talking about an entire category of people that has historically been denied any sort of resources at all. And we still see that. And so like getting creative about like grants and the funding that does exist and applying to grants that we know aren't targeted for trans people, because there aren't. Like try Googling sex education grants for trans people, because I have and they do not exist. Like I can tell you that right now, which is an issue, right? Because that's something that's so important and yet no one sees the value in that. The lack of existing content and research was a really tough one, especially when building out this material. Like it doesn't exist, right? And so we're taking kind of like what we know as a hospital and what we know as sex educators and what we know as trans people, basically, and putting it together to try to make something that's effective and works. And it's really, really hard. Like I couldn't find anything from the United States about birth control and trans people on testosterone at all. Like I had to source that from UK. And we don't know very much about PrEP and trans men. There aren't research studies about that. We don't know very much about the long-term effects of gender-affirming hormones on trans people. It just doesn't exist. I think anytime that you're doing this work, tokenization is going to be a really big issue. And I think even at like Lurie Children's Hospital, where we have so many trans employees, those employees are always used for things like this. And I think like navigating that difficult balance between like wanting to have a program that is for trans people and is by trans people, and also not wanting to constantly call out the same like 2 trans people to do all the work, especially when this specific work can be really, really hard. And that next, like unsupportive parents, that can be a really, really difficult barrier. And I think COVID has made that a little bit more difficult as well, because having these conversations at school, there's a buffer, right? And so trans youth can come to school, their parents aren't there, their parents can't listen to what they're learning about, and they can get these resources. If they're at home, we have to think more creatively about how we're teaching this, because if you're learning about this and your parents don't know that you're trans and they walk into the room, that could be a really big issue. And then with unsupportive parents as well, a lot of it is like, basically like, I use the term band-aids a lot because that's what it is a lot. It's like being in sessions with youth and trying to give them as many resources as we can, and knowing that if their parents aren't supportive, they're not going to be able to access everything. And it's going to be really, really hard until they turn the age of 18. That's why that point about birth control and being able to access it over the age of 12 without your parents' consent is really important, because we know that a lot of youth can't access gender affirming hormones, but we can tell them that they can get birth control anytime they're over the age of 12 without their parents knowing about it. And there are some forms of birth control that can stop your period, or you can only have it once every 3 months or once a year. The legal barriers, again, we already kind of talked about those. The lack of capacity and resources, and then lack of investment in the work too. I think it's really hard to get people invested in something that's really niche, especially like cis people. Like cis people just need to become more invested in this work that we're doing, because it's really important. And like I think, I don't know, like as someone who is trans, didn't get any of this and works really closely with trans youth, like you can see the difference that happens in like a 60-minute session. And so trying to find that investment and find people that are as passionate about making sure that trans youth have the same access to sexual health care, and have the same outcomes as everyone else is really important. I don't know if anyone else has anything to add to this slide from the group at large. Okay, if not, we can move on to talk a little bit about some of the content that we have.
All right. So we've done sex ed and LGBTQ 101s and all of that across a variety of settings. This year, even though we've been in lockdown and sort of doing a lot of this work virtually, we've been doing a great deal of it. So we've gotten a sense of things that people across the board are interested in and want to know about, express, curiosity around, and so on. The topics that everyone wants to know about, whether they're educators, whether they're providers, whether they're students and young people, are some of them are covered on this slide. We have the fact that anyone can have any kind of sex, like people are interested in that being brought up. How to have affirming sex talk, how to, tips for the talk. Oftentimes if we're parents or educators in any kind of session, they often want to know about how to have those conversations in an affirming way. And we can actually drop a link in the chat if people are interested, where we have a document, we have a resource sheet for how to have an affirming conversation around sexuality and sex ed topics. And navigating unsupportive parents is something that comes up, and being affirming, like how to just be affirming. The sort of overall gist of how we try to navigate these conversations and we try to facilitate these discussions is to make them youth-centered and youth-directed. And to sort of really examine our own biases when it comes to delivering this messaging, right? Like, because I think adultism and kind of assuming that one knows better when it comes to having conversations with youth without really taking into account where they're coming from, what pleasure-centered, accountability-centered conversations look like for them is an issue. And we want to make sure that we're really centering them and seeing them as stakeholders in their own future, as primary stakeholders in their own future when it comes to navigating sexuality, relationships, etc. Implicit bias and systemic violence is also something that we are often asked to talk about, asked to cover. And this, I think, is also because people have some sort of an idea that implicit bias exists or systemic violence exists, but they do want a more sort of concrete picture of how that affects young people, how that affects, LGBTQ youth, and how we can navigate that, and how we can sort of ameliorate some of those effects, and how we can affect change from inside, externally, etc. Next slide.
And this is me. So we've done as a group some provider education with providers within adolescent medicine, and from there it sort of bloomed outward, because I think it's a moment, thankfully, that providers are really interested in being more expansive in the way they approach healthcare and being more aware of trans and non-binary health and how to have those conversations. But navigating a queer sexual health landscape isn't something that you can just do by reading a paper or sort of learning overnight. It takes a certain level of comfort and awareness and willingness to admit things that you don't know and be transparent with your patients. And Adam mentioned earlier something that I think is really critical, which is adolescent patients know when you're uncomfortable. They can sense it. And that will make them uncomfortable and will make them less willing to share with you. So as providers or sex educators or teachers, part of sort of what we are burdened with is learning outside of the teaching space or the healthcare provision space, and coming to the table with young people already ready to have these conversations and navigate them kind of seamlessly, or as seamlessly as we can. And everyone, has a learning curve and everyone makes mistakes, but practicing that outside of those sessions with young people is critical. So how to be comfortable navigating a queer sexual health landscape, practice and do your research. Adam gave us a bit of a list earlier of things that you might want to be looking into, things like poppers or alkyl nitrates that young folks sometimes use for more comfortable anal sex. Kink and BDSM, which are definitely prevalent in queer communities. Polyamory and multiple partnerships. A lot of sexual health intakes and sexual health guidelines really lean towards, if not abstinence, then monogamous partnership as like the only way to navigate sexual landscapes healthfully. And we know that that's not how all young people partner. And it's really critical to give them the information that's affirming and relevant to their experience. These things might be new to you. There might be a lot of things that are new to you. So I highly recommend reaching out to us if you're interested in further training, or I list scarletine.org here as a resource. It's a phenomenal sort of youth-oriented sexual health resource that covers a really wide range of sexual health topics. Assumptions are not your friend. So, you don't know what kind of sex someone might be interested in having or might be currently having. Someone might be asexual. Someone might be asexual and also experiencing or experimenting with sex. So, never lean on assumptions when discussing sex with young folks. Always ask questions outright and be sort of affirming and willing to respond well to whatever their answers are. Conducting and affirming sexual health intake process, we can and do have entire trainings that are mostly just on this. And so I can't cover all of that in this short session. But what I can say is that it's really critical, particularly in the sexual health intake space, to be thinking about how you can be affirming to the person you're speaking with and how you can sort of exude comfort around that person, and so that they're able to have those conversations with you and able to be vulnerable about their sexual health experiences. So we've listed some of the critical topics here in this cycle. Mirror their language. Young folks might be talking about their bodies in certain ways. Trans and non-binary folks especially might refer to different body parts in very particular ways that are comfortable for them, or might talk about sex in a way that is comfortable for them, talk about their gender. And so you should always listen to the young person and take their cues as to how they want to talk about their bodies and sex. Be very aware of that, be aware of the breadth of gender and sexuality experiences. So do your research and come to the table, not, you know, not sort of siloed in your understanding of how someone might be approaching their sex and their gender, their sexuality and their gender. Exhibit comfort. The only way to do this is to practice. Come to us and practice, do research online, do research within queer sexual health spaces and with professionals like us. You can't have these conversations comfortably your first or second or third go. And so it's really important to sort of be practicing and familiarizing yourself in advance of your healthcare provision with young people. Emphasize pleasure, relationship health, and sexual safety. Adam had also mentioned that we just don't talk about pleasure enough in sexual health. And this is especially important with trans and non-binary youth. Emphasizing pleasure and relationship health and sexual safety includes things like, is your partner affirming? Is your partner asking you what kinds of sex are comfortable for you? What kinds of terminology for your body and for sexual acts is comfortable for you? Are you experiencing dysphoria in the sexual space? And you know, why and how can we help you to get to a place of pleasure and having affirming sex? Really, really critical, and also just really individual dependent. So, you know, always a place to learn. Ask them what you're missing. Queer and trans people are the experts on their experience. So you might research and study and practice, and yet you might miss something in your conversation with the young person. So ask them, what am I not asking you about? What do you want me to know about your sexual health experience? And how can we sort of learn about that together? And then be transparent about what you don't know. You know, providers, Sal had talked about how little training providers get in this kind of space. And so it's okay. Like, patients understand that you're not going to always be an expert on every sexual experience they're having, gendered experience they're having. What's really important is that you be transparent about that and tell them that they're important to you as a student, as a patient, and that because of that, you're going to do work in the background to continue learning. And you're not going to give them answers that are not well informed. So, you know, being transparent about that is really important. Anything I missed on this slide?
All right. So in terms of sex ed topics that we bring up with educators, we do cover a lot of what we cover with providers. And as you'll see in the next slide, with youth as well, you know, we have conversations around how to approach and practice language and pronouns. We go through sort of like some practice in the sessions itself, but we also encourage people to keep practicing on their own terms. You know, there's a website called -18.org. That's a great resource for practicing pronouns that we bring up in our sessions with educators. We also cover language. We do sort of a basic 101 with providers, such as talk about, you know, fundamental kind of language stuff, cis, trans, how to use those words, really emphasize that language is evolving and it's not about knowing every term that exists under the trans umbrella or the LGBTQ umbrella, but what it is hearing, listening to, acknowledging and affirming the language that the person, the LGBTQ person you're working with, the LGBTQ person you're teaching, the LGBTQ person you're taking care of or giving care to is offering you as, or asserting as the language that is affirming for them. So that's very, very important. And that's sort of the fundamental message when we do any kind of term review and things like that. You know, we emphasize that it's not about memorizing everything. It's about remembering that people are experts on their own identities. And this includes and is also specific to trans people, trans and non-binary people. we also talk about how, while people will make mistakes, it's very, very important to practice, and it's also important to be accepting of and welcome call-ins and welcome conversations around how to better ourselves as educators, as adults in situations where we're working with youth and making those mistakes, and not sort of entrench ourselves into either our mistake or into views that we've held that are being challenged, right? Again, we talk about how anyone can have any kind of sex and move away from cis-normative and sort of heteronormative ideas of what sex looks like, because that kind of sex education or any kind of conversation on sex that's centered on those ideas is myopic, is limited, and is not helpful, not just to trans youth, trans and non-binary youth, but also to, everyone in the class, because they're getting an incomplete picture about what sex, about what healthy relationships, about what, sort of navigating sexual health can look like. And that's why we encourage coming to it from a place of a comprehensive understanding of what sex can look like for any given person. We also talk about how to have those conversations in an affirming way. Some of that stuff we've covered in this presentation itself, but we go into some detail about, what check-ins look like, about how centering the youth in question looks like, and about how really taking their feedback and listening to them, modeling their language, exploring resources with them, so those conversations can be as affirming as possible, can look like. Of course, we cover birth control and PrEP, and we try to do this in as much of an inclusive way as possible, because oftentimes conversations around both birth control and PrEP, which of course is pre-exposure prophylaxis and is a safer sex tool, oftentimes those conversations can be very gendered, while in reality, it's not just people of any one gender accessing or in need of those resources. So we want to make sure we have those conversations in ways that includes and affirms people of all genders, all sexualities, all identities. We have conversations around testing and prevention and how to sort of offer those resources to youth in a variety of settings in accordance with policies that can sometimes be murky or not clear, or even restrictive in some cases. Of course, in Chicago, in Illinois, we have a certain amount of leeway to deliver these messages, but we want to make sure to endow educators with the confidence to bring these topics up and not feel tentative about having these conversations with young people. And telling them, making them feel confident about having the resources at hand so they can relay them to young people. I, of course, am a testing provider at Lurie Children's Hospital, so it's very important to me that young people know that they can get free testing, free, treatment and navigation services around birth control and PrEP across the Chicagoland area. And we take pains to make sure that educators are aware of these services, are aware of these resources, and feel confident in delivering them to the youth populations that they're working with. We also talk about why sex ed needs to be LGBTQ inclusive, and one of the things that we emphasize is LGBTQ inclusive sex ed is beneficial not just to LGBTQ students, but to every student. A majority of bullying that students of all genders and sexualities encounter in educational institutions is gender-based, and this is why coming to any kind of educational praxis with the intention of being affirming, of being inclusive is good, is helpful for across your youth populations, across your student populations, and that's important to remember. We bring up stats about how just having one affirming adult can make an enormous amount of difference in terms of reducing suicidality, in terms of improving goals around testing, around education, around attendance, and so on for students. We bring those stats up, and I think those are usually very illuminating and educational for educators, because they see those numbers and they're like, yeah, speaking up can make an immediate difference, can make a material difference to a student, or just being there for a student, just making a student aware of the fact that there is a safe and trusted adult in this space can make a material difference to the lives of LGBTQ students and all students. And modeling LGBTQ inclusive sexual conversations, bringing up what that can look like, performing that, and for students and for other educators in your space. Oftentimes, the best person for an educator to learn from is another educator. So really modeling those conversations for educators is something that we take to heart and take seriously when we do these presentations with educators, with teachers, with facilitators, with professionals working with youth. As you can see, these are some of the slides that we use in conversations with educators. We talk about the impact of gender-based bullying, gender-based discrimination on everyone. We talk about how adultism and biases affect educator and counselor perceptions on how safe students feel. 71% of mental health professionals describe their schools teachers as very or somewhat supportive of LGBTQ students, but when the students themselves were asked, it's a drastic difference. It's a far lower percentage of the student bodies responding to, responding positively to the resources available to them. We talk about very concrete kind of situations and scenarios in terms of what if a student comes out to an educator? What if a student wants to come out to a classroom? And all of these things. And, we try to be pretty comprehensive in talking about what that language can look like, what modeling affirming behaviors can look like in those situations, what dealing with parents, sort of parents who disapprove of other students, coming into those situations and sort of pushing back against inclusive and affirming education, what dealing with them and navigating those conversations can look like. So we really want to equip any educator who comes into one of our trainings with the tools that they need to have conversations across the board that, perpetuate and foster an affirming and inclusive educational climate for youth. Next slide.
This one's all me again. So these are some of the sex ed topics that we get to talk about specifically with our youth. We start our conversations with pretty much every youth that we teach talking about consent. I think when we're thinking about trans populations specifically, it's even more important. My background before coming to Lurie Children's Hospital is in sexual violence and domestic violence work. And although we don't talk about it, we know that rates of sexual and domestic violence are actually the highest among trans communities and are like at least slightly, if not significantly higher than cisgender women, which is what's commonly talked about as the group of people that has the highest rates of like sexual violence. And we know that trans people don't get the same resources as cisgender women. We just know that that's the case. And so starting it out with consent, knowing that trans people may face more opportunities where they might be faced with like having to navigate consent and unsafe situations for themselves is really important. Talking about how anyone can have any kind of sex, I think kind of, especially for trans people, breaking some of those ideas and notions that we have that your body parts dictate what type of sex that you can have. So like talking about how trans women can use dildos instead of penises if they don't want to, or talking about prosthetics and things like that, and talking about anal sex for all different people. Even in my most recent LGBTQ sex ed session, they were primarily interested in like sex that like people with vaginas have with other people with vaginas, and talking about how anal sex is also an option there and things like that. Thinking about affirming sex talk in practice and just how important it is for youth to talk about what they're interested in when it comes to sex before they're having sex. And so you can see my slide there that says safer sex equals communication is kind of the start of that conversation. And that one, that's actually a little bit outdated. I updated that one recently, but a lot of safer sex is communicating about what makes you feel okay. And so thinking about like especially for trans people, what terms they want used for their body parts. Are there specific terms that do feel uncomfortable for you? And how are you going to navigate talking about that so you're not like right in the middle of a sexual activity and someone uses a word and then it's like, I'm not interested, like that's it, like I'm done, right? And so like making sure that we can prevent that from happening. Thinking about different parts of your body that you don't want touched. I think a lot of this to me comes out of that idea of like, what does sex without dysphoria look like? And a lot of that is knowing like, what parts of my body am I comfortable being touched and in what ways? And I think youth need to be told that they should and can and should figure that out, and should talk about that openly. Different sexual activities that you do or don't want to do or are nervous about. I think also like from a trauma-informed perspective, this is really important. All of these are really important for anyone with a trauma background as well, right? Is talking about like terms that you might not want used for your body parts from a trauma perspective, in places that might not be comfortable to be touched. And then what's not on here is also like terms that you want used for yourself. And so like thinking about navigating those conversations where like, oh, like actually like I'm comfortable with you using this term, but I'm not comfortable with this one. Or like I'm non-binary, but I am okay with you using the term like daddy for me or something like that. Or some of these really gendered terms that we have, that are becoming less and less gendered, but people still have to navigate using those in sexual like conversations. And just like reinforcing for youth that it can be really, really pleasurable, and it can be really, really hot to talk about sex before you have sex. That it's not just going to be like a really boring conversation where you like list down like, this is what I do or don't want, here's what you do or don't want, but like that can be hot too, is like talking about what is attractive and pleasurable for you. Thinking about anal sex a little bit and just kind of like disrupting some of the myths around that, and letting youth know like how to have anal sex in a safe way, especially since a lot of the media that we have, like fan fiction, like pornography, things like that, do not describe anal sex in a way that's safe, do not talk about lube at all. And honestly, like that's the big thing, is just like, please use lube. STIs and STI prevention, I try to go about this though from like, not the like, here's all the scary STIs that you're going to get, and that's terrible, but more just like, here's what you do to prevent them, and like, you should get tested, and if you do have an STI, that you're going to be fine, right? Like we know that if you have an STI, like most of them are treatable, the ones that aren't treatable are curable, but like you do need to access like medical health care for that and navigate medical health care, or there might be like worse risks in talking about that. Pregnancy and birth control. A lot of folks don't tell, especially like trans masculine people, that testosterone is not an effective form of birth control, but testosterone does like stop periods for a lot of people. And so like having that conversation, which is like, if you're a trans person and you're engaging in sexual activity that might cause conception, and we show a video about like, what does conception mean, that doesn't use any gendered terms, but still kind of like shows like what might cause conception. If you're someone, then you might also want to think about going on birth control and using that in combination with condoms, if you're engaging in sexual activity that might cause pregnancy. And then with birth control as well, like for trans people on testosterone, with the stopping of periods, you also might not know that you're pregnant until a later date and time, because you might not have as many of the warning signs as people who do have periods. And then with birth control, like just going through like what forms of birth control they can and can't use. And a lot of this goes back to the fact that we know that providers might not know this. And so like, to me, it's like, I don't know if y'all have done any work or research around like the AIDS crisis in the I think like 70s, and where like gay men specifically had to become experts in like HIV and AIDS, and basically like learn all of the science behind it to get access to resources. That's kind of what it is here, right? Is like, trans folks are having to do all of this work to become the experts in birth control, because we know that doctors aren't going to be able to provide the right medical care to them. PrEP, again, and just like who might need PrEP, but talking about it from like as ungendered a perspective as possible, because when we start to gender these things, we're going to lose trans youth. They're going to clock out, they're not going to listen, or they're not going to think it's for them, even if it might be. And Plan B as well. And then talking about kink and BDSM, this one is really difficult to navigate talking about. I actually have 2 different slides for kink and BDSM, depending on the audience in the school that we're going to and what the comfort level is. One of them is like, about porn in the media actually, and then I like slide it in under 50 Shades of Grey and talking about like safe kink and BDSM, especially for more conservative schools, where that might not be a topic where they can openly talk about it. It's not on the slides, but they're getting the same level of information. And then I have one that's looking more at like for schools that might be a little bit more open to this information, looking at information about kink and BDSM, and also thinking about some of those binaries that we have within the LGBTQ and the kink community, especially like thinking about like top, bottom, verse, and dom sub switch, and the ways that we've created those binaries as well, and kind of just like navigating and disrupting that a little bit, for trans people who are already like navigating and disrupting binaries all the time. And then navigating unsupportive parents, which is honestly the most difficult part of teaching the sex education, because you can give youth so many different resources and you still know that they might not be able to access what's truly affirming for them until they turn the age of 18. And so like a lot of it is having conversations with youth to try to figure out finding supportive adults. But if they don't, just like kind of trying to instill that hope that it will get better. It just might take some time. Like I had a youth who was contacting me about like finding ways to like bind without being able to access a binder, and like talking through like, they were basically like, there is no supportive adult in my life who will be able to help me access a binder. And so it's like thinking about like, what can you do in the interim to be able to be a little bit more affirmed until you're 18 and you can get this for yourself. You can move out of home. Next slide. And then next steps for us, just some things that are on our mind as we're looking to kind of like expand the capacity of our program and hopefully to be able to reach more youth, because I do believe that this work is really important. We're looking to create new inclusive educational materials, and along with that, like looking for ways to get those educational materials out to other sexual health educators, regularly updating our curriculum. And I think part of that too is like we know that we've built this curriculum off of what research we could find, but that's not a lot of research at all, right? Because there is no research. And so finding ways to research how effective our curriculum is and ways to make our curriculum more effective and what are youth actually getting out of it. And by doing that and hopefully being able to publish that research as well, we'll be able to reach other people who are interested in doing this work, and to have some more like research and evidence-based theory behind what we're doing. Looking to apply for more grant funding. I think these workshops are really hard to do because a lot of the youth that we're doing them for don't have access to resources, and have very limited access to resources. And so finding ways to offer these to youth at low or no cost, which involves being creative about applying to different grants that aren't made for this type of work, but still might be open to it, seeing as there's such a need for it. And then disseminating content via social media is like is like a goal dream for it as well, which is like knowing that we're only in Illinois, we really only reach like Chicago and the surrounding suburbs, but this is information that trans people of all ages never got in school. And so like thinking about like, how do we create like different like educational materials that can go out to a wider audience of people and a wider age range of people, and also to cis folks as well, right? Because like the other side of it is like we're teaching this to trans youth. This should be taught to everyone, especially like having those conversations around sex and body parts. Like it's everyone's responsibility to have those conversations. And so reaching a wider audience is really important to get that started. Okay, so here are just some quick resources. We have our Never Fear talks at the top. Those are those quick conversations that we have, or they're these really quick conversations that we have between parents and youth about sexual health topics. Alexa mentioned Scarletine. I always recommend that youth go to Planned Parenthood because they do gender affirming hormones and birth control, and they're a Title X clinic. And so like, if there's a Planned Parenthood in the area, that's going to be my #1 recommendation for trans youth. I have the Amaze videos on here, but I don't love them. They're not very trans inclusive. So like, sex, etc. This Healthline article on LGBTQ safe sex is really important. That's actually something I've been working with Amaze to try to make their videos more trans inclusive, and it's like slow going. not to be shady or anything. And then just some resources for trans people by trans people. Next slide. And yeah, we can take any questions if there are any. Oh yeah.
To add the QR code. My bad. You can email us for a copy of the presentation if you're interested.
While we're waiting to see if either of our attendees have any questions, I just want to say thank you so much to all of the presenters. This was such an amazing workshop. I know I learned so many things. I think that if you're not in this space on a daily basis, you really just miss a lot. So I'm very glad that I was the moderator for this and that I was able to watch this. So thank you so much.
Thank you for the opportunity.
Yeah, thanks so much. I'm also not working in sexual or reproductive health, but this was super interesting and I appreciated it. I wonder if you guys have any so I'm a nurse. I have a background in reproductive health, even though I'm not doing that right now. And I've done a little bit of research on reproductive options for trans folks. I don't know if that's something that comes up for the students in your sessions at all. I'm just curious.
I can't speak for the youth themselves since I've not done youth sessions, but maybe Adam can touch on that. But there is an effort, at least on the providers at our institutions, part to increase access or increase even counseling around different reproductive options that trans and non-binary youth who are seen at our clinic have. I can talk a little bit about one of the studies that I'm currently working on as a research coordinator, which is developing a decision aid that could assist trans non-binary youth and their parents in navigating some of the conversations around their future families, parenthood, whether that includes biological fertility and fertility preservation or not. So that's something that's sort of under the works. It's definitely in its very preliminary testing and development stages. So it will take time, of course, to be available, but there's some movement on that, at least on the provider or research side. Adam, I don't know if this comes up with young people.
Yeah, to be honest, it hasn't come up a ton with young people. The most it's come up with is I do some more medical focus sessions on things like surgeries. And then you'll get questions around fertility preservation, before maybe getting a hysterectomy or something like that. I think given the age range of youth between the ages of it's usually 14 to 17, it might be a little bit early for them to start thinking about that. That's kind of I haven't gotten a ton of questions. I think they're still in the stage where they're I just want to know how to have sex and also have pleasure at the same time.
Yeah, I think that the landscape of the kind of education that is available or kind of resources that are available for young people is so limited that for a lot of youth, that's not even something that is a consideration when folks are trying to navigate just feeling good in their bodies or feeling good in their immediate environment. I will say that if there is a young person who is coming to our gender clinic and is accessing medical interventions, whether that is puberty blockers or gender affirming hormones, they do get counseled on options around fertility preservation as it relates to biological fertility at that stage, even before starting medical interventions, of course, in an age appropriate way. So those conversations happen, but again, this is a very select group of young people who are accessing medical care at a large children's institution that have support of their parents or have access to, you know, medical care, like medical care at Lurie Children. So it is a very small and select group of people. And there is a lot of conversation around how, you know, a lot of fertility preservation options are so expensive and just not accessible. So even if, you know, a young person before starting any medical interventions wants to pursue any kind of fertility preservation option, as it relates to their biological fertility, most of the time the cost is such a big barrier that it's just off the table immediately for them. So I think there's a lot of different layers here. But I want to say that I think, like I said earlier, just to reiterate, the state of the education or resources available to youth at large, especially youth who have multiply marginalized identities or come from multiply marginalized backgrounds, is so limited.